Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Uh, the Washington Post articles this week, one of the headliners was the key to happiness, and many people talk about happiness and how to achieve happiness. And this article is based upon an experience of a gentleman who was a president of the American Enterprise Incorporated, and at 55, he retired because he felt that he had no raison d'etre, no purpose. And so he resigned his position and decided to seek happiness. And, happiness is an interesting term because what is happy? And after being out of work for a while, he got to regain his purpose in life and realize that one of the things that contributed tremendously to his happiness was struggling. And there are many people who define happiness in very different ways. Some people feel that you're created to the honor and glory of God, and so if you dedicate your life to that purpose, that's will make you happy. He, on the other hand, feels that adversity is what really gets you happiness, and that struggling and having opportunities to deal with the negative aspects of life is what really gives you purpose, and that the more you struggle, the happier you can be. And it says that the three ingredients are enjoyment, satisfaction, and meaningfulness, and that every adversity is an opportunity to get better. And he recommends that you look upon all negativity as opportunities for improvement. And as a matter of fact, he recommends keeping a failure journal because every failure means an opportunity for you to succeed and overcome. And this then is one of the best things you could ever do, is to be able to deal with the negative issues such as pain or physical or emotional setbacks, and that the other aspect of happiness is being able to help others. And if you find people who have problems and you invest yourself in trying to help them solve them, that is what makes life meaningful, and that helps you become happy. What are your thoughts about happiness? What makes you happy?
Well, that guy, his approach to happiness, he's saying treat adversity and pain and struggle and turn it into happiness. That's like way too many lemons. I believe in making lemonade out of lemons, but that's like way too many lemons. Uh, he's that is not very cheery at all. I mean, you got to be. You got,
Well, I find it very cheering
oh,
because I think my whole life has been all about overcoming obstacles, and it has made me happy. I can tell you
okay.
that. The fact that now, the other thing about that is if you have obstacles, then you can appreciate them, and overcoming them can make you happy. And I think that is where the happiness lies when you overcome these obstacles. So that for my life, actually, I found that changing obstacles to stepping stones to success has been the key to my success in my life. So I see his perspective.
When I think about my brother-in-law John, he had obstacles all through his life, and if you spend time with him, you'd just never know what he was
Right.
going through. And so he was constantly in the process of overcoming those obstacles. But
So
I mean,
true.
that was everybody's path is different.
Yeah, that's right. Yeah, you're right. John seemed to be happy all the time. Yeah,
Uh,
in spite of everything that he went through. And he went through uh, obstacles time and time again. Anybody else want to chip in their perspective of happiness?
I like the lyrics to Nat King Cole's "Nature Boy."
Yeah,
It
yeah.
says, "There was a boy, a very strange, enchanted boy. They say he wandered very far over land and sea. A little shy and sad of eye, but very wise was he. And then one day, a magic day, he passed my way. And while we spoke of many things, fools and kings, this he said to me: The greatest thing you'll ever learn is just to love and be loved in return."
Wonderful. I think that's perfect. Yeah, that was one of my favorite songs, and the words are so wise, such so much wisdom in that in the words of that song. Yeah, to love and be loved. Yeah, Uh,
And when you're loved and be loved in return, you will be happy.
yeah, you're right. Absolutely. Good point. Thank you. How about the rest of you sharing?
Yeah, Pearl has her hand up.
Well, no, I just wanted to say I'm just happy, really, to still be alive and relatively healthy at my age and have my family around me and to be able to still do the majority of the things that I like to do, come and go, mostly as I please. And just, I'm just happy to be alive and still around to see what's going on.
That's happiness, all right. That's happiness. Any other perspectives on happiness that you want to share with us?
I could chime in a little bit. One of the challenges of my life was fear of water. I was afraid of water. I almost drowned when I was 11, and as a result, learning how to swim and scuba dive that makes me happy. You know, being underwater, watching all that whole world under there. I almost can't believe it when I'm
Like
down
another world
there.
isn't underwater, isn't it?
It is another world, and it's peaceful. All you hear your bubbles. No, nobody chatting in your ear. No commercials. So
Uh,
that kind of makes me happy. And diving with friends also that can share. It's a little bit challenging to try to tell somebody what it's like down there. But when you go diving with someone who's with you and can appreciate what you're seeing and can corroborate what you see, it's it, it multiplies the happiness. Thanks.
Thank you. Thank you for sharing. Anybody else? Joyce?
I do agree with what people have previously said before me, but I like to add one more thing to that. My happiness comes when I help others. That is a sign that rejuvenates me, and it just brings a little bit more life to me. Helping others, love, and to be loved, those are my best two joys out of life.
Thank you for sharing, Joyce. Anybody else want to share? What makes them happy?
Yep. This morning, I just want to say how happy I am to see all of you. It's good to feel like you belong to a community of people who share, um, you know, freedom of speech and, positive way of thinking. And now I feel like I'm part of this community as well, and it makes me so happy to join you every week. Sorry I missed last week.
Thank you for sharing. Anybody else? Carol, you got anything to
I'll
add?
share. I worked at the Washington Post, and I actually hated my job. I don't know why my hand won't go down. My my video is frozen, and I was happy when I was able to take one of their buyouts, and I felt like they were paying me not to come, and I was very happy about that. Pay me not to come. I'm retired. I've been retired for 20 years now, so that makes me happy to be able to do what I want to do or not whenever I feel like it.
Wonderful. Thank you for sharing. Thank you very much.
Mm.
Okay, that looks like all of us are blessed to be happy for many different reasons. Um, Second article was on one of them was on arthritis and how do you decrease your risk to get a hip replacement. And what they pointed out is that contrary to what's
Dr. Video is frozen for some reason.
some people believe, high impact X.
Dr. Callender, you're freezing. It's going, your audio and video is going in and out. Okay.
He's not all the way. I
He
guess
may
he's gonna
rejoin
log
us.
out.
Look
Probably
like he
not.
lost his connection. But in the meantime, for the sake of the recording, we just keep some noise going on until he comes back. So how's everybody doing out there? We're all happy, right?
Yeah.
Yes.
Okay. Carolyn, I retired June 1st, 2006, so I'm in the 20-year club too.
Okay. I retired the end of June 2006, June 30th.
All right.
Well, I think I have everyone beat. I retired in 1997
Yes, you do.
Good for you.
from one job. Then I started doing something else. So I was still pretty much working up until 2010. I was selling real estate, but I retired from my daytime job, as they say, in 1997.
Well,
That's
my advice is to retire absolutely as soon as you can.
well,
Amen to that.
I did go back to work basically to have something to do, and I was a substitute teacher in Arlington until COVID, and then they changed everything, and so it was they wanted me to. I had substituted for like maybe 14 years in Arlington, and they wanted me to start from step one with my transcript and everything, and I was like, no. Thank you. I can't have that waived. I mean, I've been substituting for all these years and they changed the system. But anyway, it was the commute had gotten to be a pain anyway. So I didn't go back.
Yeah, I know what you mean. You got to stay busy, but it's a lot different when you can do it because you want to rather than you have to.
I know one of the reasons why I retired, and I was in auditing and security, working with Department of Health and Services um, HR system, and we were getting ready to go to another programming processes, and one of the things that they were going to get more into was this cloud processing, and they were talking about AI and the required
Back
schooling that you
again.
would have to then the required schooling that you would have to get involved with. So when they said schooling and going back and taking classes, I said, okay, it's time for me to put my shoes on there and look for the door. And that's exactly what I did.
Well,
Schooling was not one of the things I wanted to go back to when I was in my late 60s and early 70s.
Welcome back, Dr. Callender.
yeah, I just suddenly they just disappeared. But anyway, okay. Sorry for the disappearing act, but I guess in this age of technology, these things happen. Uh, I guess we can start going to the articles now. Yeah, this is not so good news that we surpassed already the number of measles cases we had last year, and it's the highest number of cases since 1991, and that's 35 years ago. So it's when we started MOTEP, as a matter of fact, and so uh, we're going backwards, and it's not good. And there's a lot of talk about being sure that you got your measles shots because 90% of the people who have measles are the people who were unvaccinated for whatever reasons. And so it's so important to be vaccinated because it's one of the most contagious diseases of all. And it's very contagious and it's also lethal. Uh, but we've got uh, a problem in that we will probably be taken off the list of countries that no longer have measles. But so far, that hasn't been done. But unfortunately, the CDC is finding more and more cases of measles. And but if you've had the two vaccinations, then you need not worry. But if there's any question about whether or not you are vaccinated, it wouldn't hurt to get vaccinated again. So the biggest problem they think is that the number of people who are no longer being vaccinated, and that's the biggest issue. We've been measles free since 2000, so yeah, we're going backwards again. So okay, any questions about measles? We had it licked, but here it comes again. Then this cyclosporiasis outbreak expanded to 9 states beyond the original. They don't include Maryland among them, but uh, as you can see, there's been a number of cases. You can see more than things up to 4,000 now with hospitalizations but no deaths. And apparently it's easy to treat with Bactrim medication that's good against parasites. And so it's a explosive diarrhea that is easily treated once the diagnosis is made. So we don't have it in our area as endemic, but this is the most recent one that shows 45 states have it. But there hasn't been a single fatality. Hospitalizations, no deaths. So, has anybody heard locally anybody who's had any cyclosporiasis? Uh, I guess the nice thing about it's easily treated once it's diagnosed. And the lettuce apparently was the initial source of the outbreak, but the you going from 9 states to 41 states. Darryl, you had a
Yeah, I went on. Taco Bell is owned by Yum Brands, YUM. And I went on the Yum Brands website and it said there was no link to cyclosporiasis at Taco Bell. And then I did a search on link between cyclosporiasis and Taco Bell, and it says yes, there is a link. The supplier uh, recalled their lettuce that was causing the cyclosporiasis, and it was a supplier to Taco Bell. So it's just kind of interesting. The denial and advertising that's online.
It's interesting. Yeah. Well, we're fortunate it's not caused any deaths, although it has caused hospitalizations. And it's easily treated, so that's the good part of it.
I read somewhere that it can recur,
Can be
and
what?
I don't recur. So if you think you've gotten over it, that it can come back. The symptoms can come back. And I
Right.
don't know if that is for people who have been treated or who just got through an easier phase of it earlier on.
Well, the treatment with Bactrim is apparently very successful. So
Do-
so perhaps they need to take another dose of Bactrim.
I'm just wondering for people who might have sulfur allergies, if there's an alternative.
Well, so far it's so successfully treated. It's not much of an alternative to Bactrim. Bactrim is one of the simplest, easiest to obtain medications you can have, just a sulfur drug. But for people who are allergic to sulfur, of course, then becomes an issue.
Maybe I'll look that up.
John Buchanan?
Yes, I was thinking, since they linked the source to Mexico, that it could almost be like a bio invasion, uh, by an adversary. I think you know what I'm talking about. Biological warfare.
Well, it doesn't seem as though is the case. It seemed to me was just related to what they identified as fecal contamination of the water that was used to treat the lettuce. So far, there's been no association with biological warfare. Okay, so for those people who are allergic to sulfur drugs, that would be an issue. But so far, it doesn't seem as though even those patients who are hospitalized, they seem to recover uh, quite well.
Dr. Callender, I just looked up on Google, Dr. Google, for alternatives to the Bactrim, and they mentioned ciprofloxacin as one. And then there's an anti-parasite medicine, nitazoxanide. Never heard of it. But there are some drawbacks in that, of course, they're not as effective as Bactrim is.
Yeah. Thank you for sharing.
You're welcome.
This is a article that is something we've been talking about recently about continuous glucose monitoring that seems to be the best way to handle patients who have diabetes. Uh, the question is, how do you, we're getting more and more studies that are identifying the way to handle diabetes is by having continuous glucose monitoring. You see another article shortly that does the same thing for dialysis patients who have diabetes. And so it's one thing to do it the traditional way with the capillary studies, or it's another thing to have a continuous glucose monitor inserted. And we're getting more and more studies that are identifying the best way to have normalized blood sugars, particularly for diabetics, is when you have a continuous glucose monitoring. And they're suggesting the primary care doctor would be the place to start you off with that. There are some expenses associated with that, but we're seeing more and more studies that are demonstrating that the continuous glucose monitoring is the ideal way to keep a normal blood sugar, particularly those patients who have type 2 diabetes. But it works for those people with type 1 as well. I don't know how many of you out there have any experience with continuous glucose monitoring, but they do have a way of inserting a monitor that calculates your blood sugar continuously and lets you know when your blood sugar is hemoglobin A1C is greater than 6. John Buchanan?
Yes, Dr. Campbell, I've seen more and more recently folks that have the monitor on their forearm, their bicep, or the back of their upper arm. And I was just wondering if they are able to like go to the gym, swim, stuff like that with that monitor on. Will it stay in there? Is it stable? You know?
Yeah, generally there are ways of protecting that from the water. But I haven't read any articles that talk about problems with maintaining the keeping that area dry or free from, because the monitors, I think, are going to be here to stay. So we're going to have to be sure that we find ways to keep that from to allow yourself to go swimming and to do exercise without compromising the effectiveness of the monitor. The biggest problem right now is the actual availability of that in primary care practices, because all primary care doctors are not up to date with continuous glucose monitoring. And I think this is something that is here to stay. Thank you for your question. Any other comments about continuous glucose monitoring? Because I think that's going to be the state of art for for the management of diabetes. Carol?
My name is pronounced Carlin.
Oh,
Sorry.
Carlin. Okay.
I had something came on my phone. I was trying to find it where you put your finger. It's an app, I think, that you put your finger down and it's supposed to tell you your sugar level, your glucose level. I have not been able to find it, but often you have these promotions when you're what is it, doom scrolling and all that other crazy stuff. But I put my finger. You have to download the app and sign up and password and all that kind of stuff. And supposedly you just put your finger on the phone and it's supposed to tell you your glucose level. I did not follow all those steps, but I don't know. You talked about the CGM. This sounds like it could be even easier and better, but I don't know how it could do that when you don't actually have any blood or anything. It's just your fingerprint. Has anybody else heard about that? All right, that's it for me.
Well, thank you for sharing. We'll look out for it in the literature. But it looks like this CGM is the state of the art for the management of normal glycemia for the type 2 diabetic. And the app that you speak of sounds like that'll be invaluable. The only difference is that it's not continuous. Okay, let's go to the next article. This is something that we're going to be seeing more and more of. This is a kind of surprising article that talks about comparing short daily home dialysis with in-center dialysis. As you know, the home dialysis can be hemo or peritoneal, but usually it's 4 hours, 3 times a week. And they're saying that if you have it shorter periods, 2 to 3 hours more frequently, that you'll be more likely to be physically active. And therefore, it is something that needs to be studied, but it may well be a better way of having daily home dialysis and also allow you to have activity that physical activity that will decrease your vulnerability to all of the complications that are associated with end-stage renal disease and hemodialysis in the diabetic. And it was interesting how those patients who had the shorter home dialysis period and who exercised seemed to do better than the other patients. Time will tell because they didn't do it long enough. And this was study done in France and Belgium, but it looks like it's something that's going to be worthy of studying to see how, again, the shorter home dialysis will work out in terms of helping you become healthier. And certainly, we know that the vegetarians and vegans who suddenly use veganism and vegetarianism, that they are healthier. Similarly, these patients with short home dialysis who exercise more appear to have a benefit. So, but there haven't been large prospective studies yet to demonstrate this, but they are coming. This is interesting for the dialysis patient population because many dialysis patients have to dialyze 4 to 6 hours 3 times a week, and home dialysis often is as long as 12 hours a day, uh, 5 to 6 days a week, 7 days, some cases 7 days a week. So for the dialysis patient, this may be a breakthrough. Any comments about this one? Or if not, we can go to the next article. This is an article that says that young people are more likely to take GLP-1 drugs than to have the bariatric surgery, even though bariatric surgery is associated with the longer lasting and the more profound weight loss. Most of the young people are deciding on the medication in preference to the surgery. And it's not surprising. This is what's happening in older people as well. But the surgery has been shown to have the more permanent and the more dramatic weight loss, even though more people are getting the GLP-1 drugs than are having the bariatric surgery. Any comment from anybody who has used either the GLP-1 drugs or the bariatric surgery intervention?
Dr. Callender, some people in my family have tried to use these GLP-1 drugs for different reasons, but they ran into problems because they had a lot of gastrointestinal side effects. And so one person had to go back to, well, they both had to just stop the medication. And so just wondering if you had any comments about that.
Oh, there's a number of articles that have talked about the GI side effects with the GLP-1 drugs. But they are suggesting that many of the side effects of the GLP-1 drugs can be handled if you have the proper dosage. But there are still side effects from the GLP-1 drugs. There's an article that we're coming across that also identifies that in spite of the GLP-1 drugs, that many of the diabetics are still taking insulin along with the GLP-1 drugs. So it's something that over time we'll have to try to find ways to decrease the GI symptomatology. Some think it's related to the previous higher doses, but as you mentioned, there are still side effects, and as we have more time to evaluate the use of the GLP-1 drugs, we will also see some of the other side effects. But right now, it seems as though the GLP drugs certainly are effective in the diabetics and in managing obesity, but they still have side effects that have to be adequately managed in order for them to make a meaningful difference. It's interesting that we're finding more and more positive consequences of the GLP-1 drugs involving brain, liver, and just multiple organs that are positively influenced by the use of the GLP-1 drugs. But there's still side effects that require monitoring by the physician to optimize the use of the GLP and agonists. Any other
Thank you.
comments about the side effects from the GLP-1 drugs?
Dr. Callender, I have a friend who was on the DLPs, and I forget which brand specifically, but they had very serious side effects, and you know they stopped using it as a result. It was really bad, the GI side effects. So it doesn't work for everybody.
Right, right. And we're going to have to learn more about how to use these drugs and minimize these side effects, which make it unutilizable for certain patients. Okay, let's go to the next article then. And we'll see more articles about these uh, side effects of the GLP-1 drugs that make them difficult to be used by some patient populations. Little question though that bariatric surgery gives you greater weight loss than the GLP-1 drugs, but the question is, do you want to have surgery or do you want to have medication, and how long can you stay on the medication? Because usually after 1 or 2 years, you have to stop the medication anyway. John Buchanan.
Yes, I have a bad memory. Can you explain once more, probably for the fifth time, what bariatric surgery actually is? What does it do?
Yeah, bariatric surgery, bypass surgery, or sleeve surgery where they cut out 3/4 to half of the stomach, uh, is associated with the greatest weight loss. GLP-1 drugs do a good job, but just not quite as effective. But they don't involve surgery. But the long-term benefit of the surgery results in the greater weight loss and for a longer period of time. Whereas the GLP-1 drugs, after a year or two, most people have stopped taking the medication. And so the long-term effects of the bariatric surgery clearly outweigh the effects of the GLP-1 medications. But when we're talking about bariatric surgery, we're talking about a sleeve gastrectomy where they take out 2/3 of the stomach, or a bypass gastrectomy where they divert most of the food from the stomach to the intestinal tract, and cutting the capacity of the stomach to about 70 to 80% of the stomach is bypassed. Does that answer your question?
Yes, thank you very much.
Okay. All right, let's go to the next order. One of the things about the surgery is that most of the obese diabetic patients wind up with no need for insulin any longer. So that's the side effect of the bariatric surgery, that the diabetes component is markedly reduced, if not eliminated. So many of these patients that have the bariatric surgery who were diabetics before are no longer diabetics. This is an article that talks about the 15 worst foods for your heart, according to experts. Uh, we've had articles about the best foods for your heart. Now we have the article that are the ones that are worst for your heart. So we all know that the processed and cured meats are number one. We're not happy to see that ketchup is included. reduced fat salad dressings, flavored milk alternatives, good old fried chicken, fried potatoes, canned soup, capers. I don't know what capers are, so many of you may know it. Flute flavored yogurt and fancy coffee drinks, pastries that we love so much, and of course, good old sugar sweetened sodas. And then, to no surprise, good old red meat, white bread, sports drinks, those things we like the most are bad for you. And so the ultimate health elixir is water, plain water. So, John?
I may have to change my whole diet because half of what I eat is on this list. Uh, one thing I can say, I've cut out the white bread, no white bread, no red meat. I still, I don't drink as many sodas as I used to, but I still drink sodas. I love pastry. Uh, I love fruit flavored yogurt. Uh, capers, capers are those little dark brown, greenish brown, almost look like small peas that are flavored. They, but the point is they have a lot of sodium. Uh, when I get sick, I always eat uh, chicken noodle soup, canned soup. Uh, there's going to be an article about fried potatoes, which we were talking about. And I love fried chicken. Uh, I I thought getting reduced fat salad dressing would help, and now they say they don't even say salad dressing is bad. The reduced fat salad is bad for you. I'm very very upset about this article. And
So,
for me, for
any
me,
other
French fries
comments?
is just yeah, French fries is just a vehicle for ketchup for me.
Yeah.
And that's enough out of me.
Yeah,
So
well,
this article hurts me.
Well, I'm glad to see that ice cream and chocolate are not on the list. So I'm just going to keep eating.
I was
I'm
surprised by that. No
surprised
ice
they're
cream.
not on the list. Any other comments? Thank you for including this article so we could all be unhappy about our health choices. Okay, let's go to the
Wait a
next
minute.
article.
You said all be unhappy. I'm happy with my choices because I'm not on that list. I don't do the things on that list.
Any other comment before we go to the next article? Because I thought that Darryl had made up the list. Okay. This is standing on potatoes that as if we didn't know that the French fries was not good for us. Of course, the more you like it, the worse off it is for you. And we've had so many articles over the last couple of weeks that have talked about the dangers and hazards of French fries. And I think that this is just another one of them. They've had enough people in the studies, 200,000 people in the studies, 30-year study. And they found that it's just not good for you, and diabetes is often type 2 diabetes is often the consequence of yeah. So no matter how much we like French fries, they're not good for us. Potatoes are okay, but French fries aren't. That's the bottom line. Yeah. This guy's, however, is one of the few that says it's fine to eat a few French fries. Yeah, put a lot of vegetables and some proteins. Uh, it's kind of tough to eat a few French fries. If you like French fries, you eat a lot of French fries. And one, two, or three French fries is not something that most people do. So, but he's trying to be kind to those lovers of French fries.
That's like eating one potato chip.
Right. Right. Yeah. Who does that? Nobody. Yeah. Okay. So it's not the potatoes, it's the way we handle the potatoes that makes it so bad. This was an interesting article that talked about remote patient reported outcomes for patients with cancer. And what was surprising about it was that the remote patients did better than the other patients, particularly people who were young, black, and less educated. So the group that they thought would benefit from it the least benefited from it the most. So that this is saying that telehealth and programs that have remote that don't force you to come to see the doctor all the time, but the doctor takes the technology to the patient, may be better for those patients who have difficulty traveling. And this is a new study that shows that for people of color, that the telehealth and remote technologies work well for us. Uh, some instances, because of the problems with transportation and other things, even better than going in person. So I thought that's a very interesting article from that perspective. John Buchanan.
Yes, I was wondering how they can monitor the cancer at at a distance.
Well, because there's blood tests and other things that they can get that, and then they can see you by pictures. They can see what's happening to you, your weight and other things, so they can measure things to identify whether they can also talk to you and find out whether you're having more symptoms or less symptoms without you having to travel. So it was expected that this would not be the case, but it turns out that these tele technology methodologies seem to be more effective in our patients than they are in other groups of patients. Most people have thought that you need to go and see the doctor, but they're saying that using some of the technology can help do away with the need for traveling for some of these cancer patients. And this is one of the first studies on this remote uh, patient outcome monitoring. So this is one of the first of its study of its kind, and it will need to be repeated as well. But it's interesting, food for thought. Any other comments or sentiments about the fact that this study says remote outcomes are as good as inpatient outcomes? Actually, they say they're better. Okay, let's go to the next article then. There's no comment on it. Now, this is an article about cannabis. And you have many articles on cannabis these days. We're talking about its good aspects and some of its not so good aspects. And this article says that the survivors like cannabis, but the clinicians are not happy with its side effects. And this article suggests that it may well be because the survivors are not as up to date with the pros and cons of cannabis. But it's also a commentary that the patients may not know as much about cannabis as the clinicians. So one of the uh, outputs of this study is that more patients should become aware of the pros and cons of the risks of cannabis use in cancer care because some of the patients have good reason for believing that cannabis helps their nausea and vomiting and other side effects of the chemotherapy they often have to endure. So whether it's survivors being ignorant of the side effects of cannabis or the clinicians being overcautious about the use of cannabis still remains to be seen. But there's a lot of sentiment on the parts of the survivors that cannabis is helpful. Any comments from you and your family members who use cannabis? Darryl?
Yeah, one of the things I didn't know, you think about cannabis, and I just naturally default to thinking that you smoke it or it's edible. But there's a lot of other ways that patients can consume medical cannabis, and that includes you can inhale it with the vaporizer, sublingual under your tongue, topical. The creams or balms can be rubbed into the skin for targeted release or their relief, or there can be suppositories and placed rectally or vaginally, and that's a help for vaginal cancer or cervical cancer.
Thank you for sharing, Darryl. Thank you. Very good points. Okay, let's go to the next article. It's amazing how good coffee is good for you, isn't it? Cut liver cancer by nearly 50%. Uh, this is a new study that comes from George Washington University in California, Mount Sinai, and 355,000 adults. That's a lot of people over 13 years. And those people who had more than 5 cups of coffee had a significantly lower risk of cirrhosis and developing liver cancer. No cancer. I didn't know coffee was that good for you, but it's a great, interesting article. Uh, Although they emphasize unsweetened coffee. uh, for those of you who like black coffee and those who prefer the sweetened variety, still uh, the study is remarkable to show the tremendous difference in chronic liver disease in those people who drink coffee. Darryl?
For years, I was just drinking nothing but water, but thanks to the group session and articles like this, as of a couple of weeks ago, I started drinking a couple of cups of coffee every week. I kind of like it. I'm also drinking every morning 4 ounces of beet juice. So the group session is changing my drinking habits.
Thanks for sharing, Darryl. You're changing our habits, and we're changing your habits. So we're helping each other, potentially helping each other. If we will take the advice and you are taking the advice, we take your advice, we'd be better off. Okay. Very interesting article. Okay. Any other comments or questions? If not, we'll go to this is a very uh, exciting article that talks about a good way of identifying the anti-inflammatory foods from the inflammatory foods. And it's a very simple, it's a very simple, straightforward article that goes right to the chase. It says if it's leafy vegetables, it's good for you. It's not vegetables or fruits, it's not as good for you. To just cut to the chase. Uh, uh, it's not saying you should be a vegetarian or a vegan. It's just saying that those foods have that are vegetables and fruits are healthy and good for you, particularly those that are leafy and green. But it also talks about other aspects. But to cut to the chase, and then it talks again about good old coffee. Yeah, but and nuts, which there are very few articles that talk about anti-inflammatory. They don't include uh, nuts, uh, dark leafy greens, olive oil, nuts, and coffee, and tea. Yeah, so any comments? This is a great article. It also talks about flavoring, which is a way to avoid the salt and sugar with the turmeric, ginger, cinnamon, and other products. Very good
Well,
article. Everybody should read it and digest it and follow some of the great advice. They emphasize the importance, as Darryl has done many times, of fiber. It's tough to overestimate the importance of role that fiber plays in all of this. John Buchanan.
bad memory here. Can you elaborate on inflammation? What does that mean? What is inflammation?
What is inflammation? Oh, inflammation is the process by which you have your antibodies and your cells knock out substances that don't belong. So our bodies, we live because our immune system attacks those forces that are against us. And so that's the inflammatory process that keeps us alive. And so when you're sick, and you have foreign invaders coming into your body, you need an inflammatory process to eliminate them. However, when you're well, you don't need those same inflammatory processes. And this article is saying that when you're healthy and you don't need those, these sources of food, which are not inflammatory, are good for you because you don't need the inflammatory process to be there. And the chronic inflammatory process is what causes cancer and many of the negative things that happen. And so it's important, therefore, to have anti-inflammatory foods because then your body is not fighting off things that it doesn't need to fight off. That's an oversimplification of what this article is talking about, and that yes, if you have an infection, you need an inflammatory process to knock out the foreign invaders that come in to destroy you, bacteria, viruses, protozoans, bacteria, all those things. You need an inflammatory process for those. But if you don't have an infection, these same processes that knock out disease cause problems themselves. And so in order to combat that, they're suggesting that you have anti-inflammatory uh, products that don't provoke inflammation. That's one way of simplifying it. Anybody else want to try to help John understand the importance of the having anti-inflammatory uh, foods rather than inflammatory foods? Did that help you at all, John?
Uh, I'm, I'm aware of the immune process, the immune system. It's just that I don't know, for some reason, you know, I don't remember when I was studying immunology that they talked about inflammation. So, I'm trying to relate both of
Well,
those
immunology
ideas.
and inflammation are pretty much the same because uh, immunology is all about how the body provides the sensitized cells and the antibodies that knock out the
Right.
foreign invaders. And these foreign invaders can be bacteria or viruses or protozoans. And that is what the immune process is all about, protecting your body from substances that don't belong in your body. And so that's what the inflammatory process and the immune system is actually all about. Darryl, you want to give it a shot?
Okay. Like Dr. Callender was saying, um, let's see. If you have invaders to your body, if you have disease, then that signals the body to start an inflammatory response. And that response is it recruits immune cells to, well, okay. Yeah, there is a, well, if you think of it like this, you hear a lot of talk about antioxidants are good for you. And so oxidants cause tissue damage. Antioxidants repair tissue to give you healthy tissue. And so if you're eating foods that are inflammatory, they're causing tissue damage, just to think of it in a very simple way. And if you have a healthy diet, then you're eating foods that are antioxidant and they're repairing your tissue. How about that? Does that work?
Yeah, I like
That,
that.
that, that points me in the right direction. I appreciate that. Thank you.
Yeah, it's good. Thank you, Darryl. Okay. Any other comments or questions? It's a very important article to read and appreciate because it's the key to good health. The fiber issue that Darryl keeps bringing up is so important as well. Colin?
Yeah, I was wondering where we can get a copy of this article.
Ah, well,
Oh,
then don't you send them out the copies, John?
Yeah, this article's in your email.
oh, okay. I didn't realize that. Thank you.
You're
Yeah, so all
welcome.
of you should have it. Yeah. All of these articles you should have, matter of fact, because John uh, does a great job of sharing these articles with everybody who participates in the group. So, okay, let's go to the next article then. This is an interesting article that talks about skin lesions that could signal heart problems, and they target psoriasis more than anything else. Talk about eczema as well, but psoriasis is the one that is more associated with cardiac problems than any other skin lesion that they talk about. Uh, and they bring it up again and again that psoriasis, which is more common among people of color, uh, but I don't recall having many psoriasis patients in my practice, but it is more common in people of color, and it is associated with heart-related issues. Eczema has been a lot more common, but not as related to cardiac conditions. I don't know if any of you have any of your family members have psoriasis, but you see many commercials on psoriasis and the use of medications for the rashes that occur anywhere in the face, the scalp, the back, and all over the place. And they can flare for weeks and then they go away and they come back again. And so this article uh, mentions time and time again that the psoriasis is one that is more associated with cardiac disease than any other. And this is a disease where the skin, which is the largest organ in the body, actually is soaked with inflammatory lesions that can be very problematical and ugly. So, any comments? Any of you know any people who have psoriasis or then, of course, as you age, you get all kinds of spots that occur. Darryl?
Yeah, I don't know anybody with psoriasis, but I do know people with lupus and similar symptoms. They're different, not the same, but you can get hardening of skin. The plaques, I think, are different, but the skin plaques, that's what shows up in psoriasis. I think it's represents differently with lupus, but both are responses to inflammatory diseases and cardiovascular, like they say, it may be an indicator of heart disease because heart disease, cardiovascular disease is an inflammatory disease. It represents when there's inflammation in the body. I mean, these are all related to inflammation, and we have been talking about inflammation, in this section, but in this session, but they seem to be all related diseases.
Yes, and I think I've seen much more lupus than I've seen psoriasis. Uh, okay. Any other comments? If not, we go to the next article. That's it?
That's it.
Okay.
Finished.
Any other comments or questions about any other subjects that we need to discuss? Well, thank you for coming today. It's we have a number of our members who are at the National Medical Association meeting in Puerto Rico, and so we miss them today and hope that the weather's good there and that they have a good meeting. And hopefully by next week, a lot of remember next week is National Minority Donor Awareness Month. There's a month in which we heighten the need for minority donations. An ounce of prevention is worth a pound of cure, and so healthy living and getting your blood pressure checked and getting it normalized and keeping your blood sugar and your cholesterol at good levels are important ways to stay healthy. So this is something that all of us should take advantage of it. John?
Yes, I wanted to encourage all of us to donate blood. There is an extreme shortage right now. I was on the news last night about the need for blood donors, especially if you have O. I'm O positive. I just did my 119th donation on Tuesday. It's and I hate needles for real, but it's a really good feeling to know that you can help up to 20 different people with a single blood donation. So if you're able, please go out Red Cross, the NIH. I donate at the NIH. I've been doing that since I met Dr. since I heard Dr. Callender almost 30 years ago. Isn't that something, Doc?
30 years, actually 30 years, 1996.
Wow. 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 So yes, it's a really good feeling. How many of y'all are donors? Anybody else blood donor?
Being in the
Okay,
transplant
well,
field, they discourage you from being a donor. Any others? Any other blood donors out there?
Well, I used to donate, but the last time I attempted to donate, they did not take my blood. This was probably 10 years ago, and I don't know why they didn't take it. They probably did tell me, and I don't remember. But anyway, I know they gave me some orange juice and told me to go home and get some rest. But prior to that, I had been a donor for years. You know, we used to have blood donations through the postal service, and every year we would have a thing where we would donate, and I donated through that, and also through the board of realtors when I was a real estate agent. But I probably have not donated any blood, and well, in fact, I know I haven't donated any in the last 10 years.
Well, thank you for sharing. It's amazing how many people's lives are saved by blood donations. Pearl, was that you?
Yeah, that's me. I need to put my hand down.
Okay, all right. Okay. All right. Well, thank you for being with us today, and God bless you and be with you till we meet again next week.
Is that the old applause is back?
it's back.
Be
Let's
safe,
go.
everyone.
Okay, bye.
Have a great week. Ciao.
Thank you. Bye-bye.
Have a blessed day.